How's everyone doing tonight?
Good, thank you.
Excellent. Thank you so much for coming out in the middle of snow and a little adverse weather here, but I'd say overall it hasn't been too bad a winter, so I think we'll take it. Well, I'm Dr. Ankit Patel. I'm a board-certified otolaryngologist. I specialize in treating patients with sinus conditions as well as allergies. So tonight we were going to talk a little bit about some general sinus conditions, how we can treat them, as well as some exciting news about some new breakthroughs as well as new technology that we have available here at Silver Cross that may or may not be applicable to some of your particular cases or friends and families. So the title of the talk, I just said sinus, sniffs, snorts, snots, headaches, and more. For patients, sinuses can mean a lot of different things. Some people can think of it as causing headaches. Some people think of runny nose, stuffy nose. So I kind of wanted to break that down a little bit and talk about, first off, what are the sinuses? Why do we have them? And then some of the things that can go wrong, and then how do we treat and manage those? So first off, what are the sinuses? In fact, the paranasal sinuses are air-filled cavities that we have in the head, and we have 4 pairs of them. So we have 8 sinuses in our heads. 2 frontal sinuses, which are here above the eyes, 2 sets of ethmoid sinuses, which are here between the eyes, maxillary sinuses, which are the cheek sinuses here, and then if you look at the picture underneath here, the sideways view, there's a sphenoid sinus here, basically all the way in the back of the head. And, well, now that we know kind of what they are, well, what do they do? Why do we have sinuses? And the short answer is we don't exactly know why we have them, but we do know certain things they do. And a couple of things. These can almost be thought of in several different ways, but part of it, they are air-filled cavities that lighten the head. So if all of that space were bone-filled, your skull and head cavity would be more than triple the weight. So 1 is to just lighten the head. 2 is they serve as a resonance chamber for voice. So you might notice too, if you get sick or if you get a cold or if you're feeling stuffy, your voice changes, doesn't it? It sounds a little bit more stuffy, a little more nasally, and that's because of congestion. And when voice comes up through the vocal cords and through our mouths, part of it resonates throughout the nasal and sinus cavities. And in fact, one interesting thing is that there was a study that showed if you are having some nasal and sinus congestion, a little bit of pressure here, something simple like humming can actually help to relieve some of that pressure a little bit. Okay? I think you all had an idea that the sinuses certainly can produce mucus. In fact, several pints of mucus are made throughout the nasal cavity throughout the day in all of us. Most of that gets dissolved into air that we breathe in, so you don't even notice the majority of it that's being produced. Okay? An immune function. So when you get sick and you get a cold or when you get a sinus infection, some of that immune processing where the white blood cells kind of fight off infection is occurring within the sinuses. So, the common cold affects the nasal cavities and also the sinus cavities, and those air-filled pockets serve as what we call antigen-presenting sites, or places where the white blood cells can help to fight off infection and clear them off. And finally, one of the other functions of the sinuses, they almost serve like a shock absorber. So for example, if you were in a car accident and hit your head, the frontal sinuses, because they're air-filled, it's almost like the body's natural kind of bumper that can basically collapse a little bit and protect the brain, protect the rest of the spine, so it serves as a protective function as well. And throughout the course of any of this, we'll keep it informal. If a pressing question comes up, please ask. Otherwise, we'll plan for going through some questions and discussion at the end, okay? So what's a little bit of the background about, how do sinuses, sinusitis, allergies, how does this impact on the overall healthcare environment, and what's been kind of the evolution over the years? So 37 million people in the United States suffer with sinus conditions, and the overall cost to the healthcare system is about $8 billion. That's with a B. So this is a very common problem that affects so many different people. And the excellent news is that there's been very big advances over the last decade, and particularly in the last 5 years, there's been tremendous growth, both in terms of research, but also in terms of the science that's been translated to things that we can offer patients in terms of new technologies. So treatments have gone from what it used to be, which is very invasive, always requiring gauze packing, to really minimally invasive options with little to no downtime, excellent outcomes, and no packing required. So there's not any need to suffer in silence anymore. Let's come on in and get seen and try to get better. Okay. So one of the common nasal and sinus problems that we see is a deviated septum. So you guys all may have heard of that term before. So septum is the cartilage and bone that divides one side of the nose from the other. Okay. And so a deviation is a bend within that bone or cartilage that can partially block breathing. And these are super common. These can happen for any number of reasons, but really the two most common things after a trauma, like breaking your nose, can lead to a deviated septum, or it's very common to be born with this. So you can thank mom or dad for a deviated septum a lot of times as well. Okay? And so if you had a deviated septum that were significant, well, how would you know? What symptoms might you have as a result? So the first thing is trouble breathing through the nose. Okay, so blockage, congestion, and noticing that you're breathing through your nose is particularly worse on one side than the other. And that's due to the anatomic blockage or obstruction. You can see in the bottom picture there, so the curvature or bend of the septum to the side. If you look at the top, that's a more normal and a straight appearing septum, allowing equal space for airflow. Compare that to the one down here, you can see how it really pushes over or bends to that other side, limiting airflow. And so treatments, if it's really just mild and not causing too much problem, sometimes nasal sprays may be sufficient to just reduce some of the congestion around that deviated septum to help with breathing. If you're getting nosebleeds, a little bit of saline or moisturizer can be helpful. For cases where conservative measures aren't working, well then surgery such as septoplasty is an option to correct that, to help with the breathing through the nose. Turbinate hypertrophy. So turbinates are structures that we all have that are inside the nose. We all have 3 sets of them on each side. So the inferior, the middle, and the superior. So the bottom, the middle, and the top. And if you look at the top picture here on the right-hand side, it kind of gives you a sideways view of those turbinates. And essentially what they are is finger-like projections within the nasal cavity, and their purpose is to help humidify air, to help with mucociliary transport or mucus transport within the nose. And in all of us, we have what we call the nasal cycle. So these structures are also filled with blood vessels. They get a fair amount of blood supply. So in all of us, they take turns shrinking down and swelling up, often alternating. Now the trouble is, if they get too much blood flow, such as in patients with allergies, these guys will get quite swollen, stuffy, and cause trouble with breathing through the nose and nasal congestion. So sometimes people feel like they're full and they want to blow their nose, but not getting much mucus. The reason's often because the turbinates are swollen and congested. So treatment options for this, if you have turbinate hypertrophy or enlarged turbinates, oftentimes involves finding out, is there an underlying cause, such as allergies, which is super common, treating allergies, which could be something simple as some nasal spray like Flonase or medication like Allegra or Zyrtec. And if that medication is insufficient, then there are procedures that can be done within the office to shrink the turbinate. You can go in with a little wand that shrinks the inside, almost like an ultrasound treatment or radiofrequency treatment, that shrinks the turbinate and gives a few little extra millimeters of space so there's not difficulty breathing through the nose. Okay, allergies or allergic rhinitis. So commonly known as hay fever. These can be seasonal symptoms or year-round symptoms. So just because you have symptoms year-round doesn't mean it can't be allergies, because things such as dust and molds are common to see throughout the year. And symptoms, common symptoms that we get, sneezing, watery eyes, itchy eyes, and particularly you might notice if certain exposures bring it on. If you're exposed to your pets and you're noticing that you're having really itchiness of the eyes and wateriness of the eyes, or sneezing as that occurs, or certainly spring and fall are the common ones due to ragweed and tree pollens. Okay? And treatment here, if you know what it is you're allergic to, avoidance is the first line of treatment. So things such as allergy pillowcases, washing the sheets in hot water can treat dust mite allergies. Allergy medicines, some are over-the-counter, some are prescription, such as nasal prescription sprays, such as Nasonex, Patnace, Flonase. There's medications called Singulair, as well as Zysol and Allegra, as well as Claritin, that can help reduce some of the symptoms here. But we certainly have some patients that, despite medicine and despite trying to avoid some of these things, they still have symptoms. So what are those patients to do? Those patients have the option to get desensitized to the things that they're allergic to. So essentially, either allergy shots, which you've probably heard of, which involves coming in and getting some shots to basically desensitize the body to these things you're allergic to, or allergy drops. And these are the same concept as allergy shots, except you don't have to come into the office. It's just one drop under the tongue a few times a day, and then what happens gradually is it teaches the body to not react to these things that you're allergic to. So essentially what's done is we take very, very dilute concentrations of some of the things you're allergic to, lower than what the body can detect, and then gradually over the course of months and years, kind of gradually ramp it up. And then what happens is the body essentially gets desensitized or builds a tolerance to these things that they're allergic to, and it works very well. Sinus headaches, so headaches and pressure here. This is a common complaint that we see from patients, and the natural inclination anytime somebody has pain and pressure here is, it's my sinuses, it's from sinus infection, take antibiotics, but in actuality, that's not always the case. There's other things that can cause sinus headaches. In fact, the most common things that we find actually is sinusitis is a potential cause for sinus headaches, but it's much lower down on the list. Higher up on the list are allergies, migraine, and migraine variants. So there's actually a variant of migraine headaches that affects the sinuses, and it's because the same nerve ending and vascular pathways that exist within migraine headache also exist within the sinuses. So triggers from allergies can cause sinus headaches even without infection. Okay? And so, how do you tell the difference whether it's infection versus allergy versus migraine? One key thing that you keep in mind on your own, if you're just having facial pressure but there's no discolored nasal drainage, the mucus is clear, it's probably not sinus infection. So, if you're going to a quick care and they're doling out some antibiotics, you might want to be careful about it, because not all sinus headache is from sinus infection. So if you want to get this evaluated, if it's been ongoing for some time, what we do within the office is we take a history, detailed history about when does it come on, what are your triggers, what makes it better, what makes it worse. Do a physical examination. We may also do some imaging, where we take an x-ray or CAT scan of the sinuses to get an instant picture. Is there truly infection or inflammation going on there, or are they clear, in which case we may talk more about the allergy and migraine pathway. We may also perform nasal endoscopy, where we look with a little lighted telescope within the nose to check and see, are there any anatomic problems or blockages there within the office. And we may also consider allergy testing if it looks like allergies are part of it based on your history. Okay. Treatment varies. It depends on what the cause is. So, certainly if you're having infection, well, we treat infection. But on the other hand, if it's more kind of migraine variant, then we may go a different route. So oftentimes treatment is medication, and then in certain circumstances, procedures may be considered. Nasal polyps. So what are our nasal polyps? These are our little growths that you can almost think of them like a little cyst or a little water balloon or a bag of grapes within the nasal and sinus cavities. And this is a picture, if you look here, so this is within the nasal cavity, but you see this kind of light yellow, tannish colored structure here. Almost looks like a little cyst or grape, doesn't it? That's a polyp within the nasal cavity. And people can get these and they can obstruct the sinus cavities, they can obstruct breathing. So it's, for us within the office, sometimes I'll see somebody and say, Doc, I just can't breathe through the nose. And I'll look in there and they've got polyps that are completely obstructing them. And it's just been kind of happening gradually over the years. So they didn't really think much about it until it really got to the point where there was no space in their nose. And so these things, nasal polyps, so you might have heard polyps within the colon, but within the nose, polyps are usually benign, okay? And especially if you have polyps on both sides of the nose, those are most commonly benign or not cancerous. Now, the exception can be if it's a one-sided polyp and it has some irregular features, those things can potentially be benign tumor or they can be cancerous. It's rare, but it happens. And when it does happen, they are treatable, but you want to make sure you get it evaluated in a timely fashion. So what kind of symptoms might you get if you had nasal polyps? The big one is trouble breathing through the nose. Okay, nasal congestion, reduced sense of smell is a common complaint of patients with allergies as well as nasal polyps. And then the other thing is kind of chronic drainage from the nose, so clear nasal mucus, thick mucus, sometimes leading to infection, okay? And then how are these treated? So usually once you're at the point where you have polyps, this is usually a surgical procedure that's required. Medications, while they can sometimes help to shrink polyps, they don't get rid of them, long term. Okay. Upper respiratory infection or the common cold. So, you guys know the typical symptoms of this. You get a stuffy nose, you start to feel under the weather, eventually you start having some discolored nasal drainage, postnasal drips, some sore throat, maybe some cough. The key thing in terms of this is the duration of symptoms. So, typical common cold will last 7 to 10 days, maybe up to 2 weeks, okay? And, even if you're having a little bit of low-grade fever and some cough, if symptoms have been going on less than 10 days, don't rush off to get antibiotics for this, because 98% of these are viral. And so, going into the quick care, if you've had symptoms less than 2 weeks, if they're giving you antibiotics, I would caution against it, because the one thing that's going on nowadays is we have an epidemic of using too many antibiotics sometimes. And if you arm yourself with a little bit of knowledge, knowing that even if symptoms are a little bit rough, if it's lasting less than 2 weeks, try to fight it off. So rest, hydration, over-the-counter medications can be used to kind of treat the symptoms. Steam can be used as a natural decongestant. Honey, a teaspoon of honey, a couple of times a day works very well as a natural kind of antimicrobial treatment, but it also treats cough. And non-caffeinated teas, and avoiding antibiotics in general if the symptoms are less than 10 to 14 days, because these will clear up. And sometimes it gets tricky because if a patient were to go into the quick care or see a caregiver and they were, let's say, a week into symptoms, and then they got a week's worth of antibiotics, and I'm like, Doc, I got better with antibiotics. Well, it took 7 days of antibiotics. They were 7 days into it. They probably would have been fine if they would have just waited another week. And so this is something we got to be careful about, because we're getting more and more resistant bugs, and we're going to start running out of treatments that we need if we're constantly pouring them into our bodies when we don't need them. And the exception would be, certainly there are some patients that have either really severe asthma or other complicating factors. If you're having trouble breathing or there's high fevers to 103, 104, that's a different story, But for typical common cold, let it run its course. Okay, so sinusitis. three common kind of ways we divide up sinusitis: recurrent, acute, subacute, and chronic sinusitis. So the first one is recurrent acute sinusitis. And symptoms we get, some of them are similar to the common cold, but the key difference is you get all the discolored nasal drainage, but you get severe facial pressure with it, okay? And often dental pain, cough can be associated, postnasal drip, and with this, if symptoms are lasting more than 2 weeks, then that's when we give the antibiotics. So even if you're getting some facial pressure here, but symptoms are lasting less than 2 weeks, try to fight it off, okay? Now, if this is occurring on a recurring basis, and by recurring basis, we usually mean if this is happening 4 times a year or more, then that's too much. And that can be a sign that there may be some underlying either anatomic problem, like a deviated septum, or a narrowed drainage pathway of the sinuses. And there are minimally invasive treatments that can be done both within the office as well as under anesthesia in the operating room, such as balloon sinuplasty, that can make a big difference for you. So chronic sinusitis. So this is not just somebody who gets recurring acute infections. These are patients that have symptoms for greater than 3 months. So imagine having yellow-green drainage from the nose ongoing for more than 3 months. So for 3 months, 6 months, sometimes years. They may get active flare-ups also, where things get worse and they get treated, but after they get treated, they don't get all the way back to normal. They get partially better, and yet they keep symptoms such as congestion, thick mucus, sometimes facial pressure, trouble breathing. So even when you treat the acute infection, while they might get better, they don't get all the way better. And so these are patients that often have been treated by the time they've come to see me. They've had many courses, short courses of antibiotics, 5 days, 7 days, sometimes 10 or 14 days of antibiotics, but without relief. And when we see these patients, we examine them within the office. We'll often do endoscopy or get a CAT scan. And if we see that there's some significant chronic sinus inflammation there, we may take a little culture to determine if it's a bacterial or fungal infection, and then treat based on culture. But these patients, the ones that have been having symptoms more than 3 months, the typical 10 or 14-day course of antibiotic isn't enough. They need 3 to 4 weeks in a row of antibiotic, along with nasal steroid spray, saline. A lot of times we'll often add a course of oral steroids such as prednisone to reduce the inflammation within the nasal cavity. Okay. For patients that fail that treatment, then those would be patients who would be potential candidates for either functional endoscopic sinus surgery or a balloon sinuplasty procedure, potentially within the office or in the operating room. So what causes this? So, some of the common triggers for recurrent acute sinusitis, the common cold and other viral etiologies can cause this. What happens is you get nasal congestion, the virus comes in, causes swelling, and then things back up behind it and get stuck or trapped within the sinus cavity, and then that leads to bacterial infection. Okay, it's a common cause for recurrent acute sinusitis. Allergies also play a role. So if you have bad allergies and you're producing double or triple the normal amount of mucus, well, bacteria eventually get into those little pockets of mucus and then lead to infection. Okay? Environmental irritants can aggravate the sinus cavities. Smoking is a known risk factor for chronic sinusitis and a known irritant to the sinus passages. Okay? Nasal polyps, which we had shown before, physically can obstruct the sinuses, and then you can imagine if the sinuses are obstructed, well, that can lead to infection behind the sinus cavity. And then other anatomic variants, such as a deviated septum or narrowing where the sinuses naturally drain, can also be an anatomic or structural cause for sinus infection. Okay? There's also a lot of other research going on about chronic sinusitis, what's causing patients to have 3 to 6 months to years of chronic infection and inflammation within the cavities, and certain theories that have been put out there. Biofilms, so these are, you can almost think of them like little microscopic structures that bacteria are building that basically allow them to live within the sinus cavities. And then antibiotics, they can kind of clear away the little bacteria that are living on top of these little biofilms, but they're not strong enough to clear the actual biofilm itself. So one example of a biofilm in a different place is dental plaque, okay? And we all know, I mean, antibiotics, what do they do for dental plaque? Nothing, right? What's the treatment? You have to brush to break it apart. So by the same token, if there's biofilms within the sinus cavities, it has to be irrigated or flushed out or requires other treatment. Antibiotics alone wouldn't be enough. Super antigens, this is a theory. There's certain bacteria, particularly staph, that has a little marker on it. And the theory is that the body overreacts to this marker from the staph. And it leads to kind of overzealous inflammation. And what the result is, you get swelling within the sinus cavities and infection, thick mucus, etc. Immune system dysfunction. So there are some patients that, the reason that they're getting infections is because their immune systems don't work well. And so you can have certain immunodeficiencies, like not producing enough antibodies, that can be a cause in certain cases. And they're also doing research into genetic causes as well. Okay, so the three different types we talked about: acute sinusitis, symptoms typically lasting less than 4 weeks in a row; recurrent acute sinusitis, so people that are getting infections but several times throughout the year, 4 times or more typically. Okay. Normal for the average population might be 1 or 2. So if you're getting 4 or more, that's too many. And then chronic sinusitis if symptoms are lasting more than 3 months. And those are some of the treatments that we've talked about before there. Okay, so functional endoscopic sinus surgery. And so there's a big difference now between what it used to be 10 years ago as compared to now. So brief overview of this. This is a surgical procedure typically done under general anesthesia, usually about a 1 to 2 hour procedure. And what's done is the obstructed sinus passages are open. And if there's any polyps there, we remove the polyps. If there's any discolored mucus or infection in there, we'll take a culture of it, and we'll irrigate and flush out the sinuses. In the old days, they used to pack everybody. Now, that's almost never done. So gauze packing is now required. And this is typically an outpatient kind of procedure. Okay? So many improvements over the last decade. And some of the things, particularly less invasive, no packing. Pain-wise, if there's no septoplasty required for sinus surgery, then the pain's actually quite mild. It's usually, if septoplasty is required, then that can be more of a moderate discomfort afterwards. Okay? There are navigation systems, which we use, and I have a slide about that later, which allow us to track our instruments with sub-millimeter accuracy. So almost like GPS, so you know exactly where you are. Okay? There are topical medicated implants that can be placed that basically release anti-inflammatory medication to shrink polyps and reduce inflammation in the healing period afterwards. And I've got a slide about that later. And what that does is it allows topical medication delivery directly to the sinus cavities. And generally speaking, recovery period is going to stay about a week. In terms of time off of work. Balloon sinuplasty. So what is this? So you guys may have heard of at least the term balloon sinuplasty, or heard commercials on the radio about a smart sinus procedure. What is this? What does it involve? So essentially, this process involves a small guide wire or a guided instrument that allows us to pass very gently into the sinus cavities. And then the balloon inflates, and the tight sinus passages are then dilated, similar to angioplasty. Okay? And the advantage of this technology is that it allows us to preserve the native or natural anatomy of the sinus cavities, and basically does not require any cutting or physical tissue removal of the surrounding bone. And so there's a few different methods that we have. I have a cartoon of one of the methods. that we use. Let's see if we can get this to play here. So this is one of the techniques that we use, and essentially there's a little guide that passes into the sinus cavity. You can see there that there's mucus within that sinus cavity. Then we advance the balloon into the sinus cavity, and then the balloon inflates, like angioplasty. Okay? So this is going to be shown here in just a moment. Balloon passing in, the balloon inflates, and then that basically moves over that narrowed or tight sinus passage. And when they've done studies looking at this, you might think, oh, if it's just inflated and then it's deflated, what prevents it from closing back down? But when they've done studies on this, these sinus cavities remain patent with about a 91% functional patency rate 2 years afterwards. So through that, irrigation can be done, the sinus cavities can be suctioned, and then the guide wire is removed. And we have the advances nowadays that this can be done within the office. This can be done on a Friday afternoon. You recover over the weekend, and then you're back at work Monday. Okay. So, what are some of the advantages of this kind of technology? Well, it's safe. There are hundreds of thousands of cases here that have been done. Well, let's say 40,000 patients here that have been treated. And this is something where it's been shown to be effective. There's a quick recovery, and there's minimal downtime. This is a testimonial. Can you hear this?
Specifically, maybe 10, 15 years or so. And then over the last maybe 5 years, it's been increasingly worse. So it just got to the point where I just needed to do something about it, something that was very effective. At first, to manage my symptoms, I would try over-the-counter medications, but after time, that just didn't work. So I went into my doctor, my general doctor, and he prescribed me different antibiotics, and I took that and tried it. But really, after time, that didn't work at all either. So it just got to the point where something needed to be done. At first, I saw my general doctor once in the fall and once in the spring. Over the time, though, as time progressed, it became several times in the spring, maybe a few times in the fall. Just got to the point where, actually, at the end, I was seeing him maybe once a month, just trying to keep everything in check. Just the idea of looking into something that was maybe more permanent, something that I wasn't going having to take pills every day, with the chance that maybe it would wear off. This would be something that could potentially change my life and my whole outlook on life. It was very, very simple, and definitely did not expect it to go as quick or as painless as it did. So it's been about 5 months since my balloon sinuplasty procedure, and definitely I couldn't be happier with the results. I don't feel the pressure anymore. I mean, it was painful. Now it's gone. I just feel so much happier, and I don't have headaches anymore. I can't explain how happy I am about the results from it. It just really made a difference in my life. What I would say to patients who are considering balloon sinuplasty is do it. Definitely do it. If you have the sinus pressure and the pain and things like that are associated with stuffing the face and everything like that, balloon sinuplasty changed my life. And I definitely think that you should take a look because it might change yours too.
So, and everyone's different depending on certain situations. Certain people might be better candidates for these types of procedures. Other patients might be better candidates for nasal sprays and other treatments, but this is certainly a great option that's come up for us. It's allowed us to help patients within the office setting as well as within the operating room. One other excellent system that we've been able to bring here to Silver Cross in the operating room is a navigation system. And the particular navigation system that we use here at Silver Cross is called the Medtronic Fusion System. And essentially for patients that require traditional sinus surgery where they have polyps or just severe sinus disease such that they're perhaps too far for a balloon procedure, they may require surgery within the operating room to remove polyps. And this technology allows us to basically track our instruments in real time to keep important things safe. Because if you think about it, where are the sinuses? They're an area, they're above the eyes, they're between the eyes, they're underneath the eyes. So these are all, areas that you have to be very careful with. And so using the navigation allows us to do surgery more safely and more completely. Okay? And this is, if you look here, this is kind of a picture. The crosshairs are basically, in real time as we move our instrumentation. It allows us to see exactly where we are so we can address and target the affected areas and preserve areas that aren't involved. Another new advance within sinus care is the propel implant. So this is a steroid-releasing implant which can be placed both within surgery, but in certain cases it may be able to be placed within the office setting as well. And what this advance does is it goes in and it expands within the sinus cavities, and it delivers topical anti-inflammatory medicine to the nasal and sinus cavities. So this is very important for patients who have polyps to reduce inflammation around that area, and also patients who have chronic inflammatory sinusitis where they have a lot of swelling of their tissues. And placing this implant, which is available here at Silver Cross, allows the tissues to heal more completely and with less inflammation. So basically the implant goes in and then it expands and then it delivers the topical medication and it dissolves on its own, usually over the course of about 30 days. And so if you kind of look here on the right side, they call it the control. This is from one of their studies. So this is, on the right side is, they used the same material, but they didn't put in the anti-inflammatory medicine, so they would call that the control. And you can see at the bottom, after some time, polyps started to regrow there. Whereas on the other side, when you place the medicated implant, 30 days later, you can see that cavity at the bottom remains pristine. There's no regrowth of polyps. And the other exciting thing that's going on is that they've developed an implant that it's not out yet, but it's going to be out soon, that can be placed within the office that can shrink away polyps without needing to go to surgery. And that's huge, because if the more that we can treat patients safely and comfortably within the office without requiring general anesthesia, it's just better. So all of these things together have really advanced and transformed the way we practice medicine. We still have a ways to go yet. There's certain things that we haven't figured out and haven't cured, but these advances incrementally are making a big difference for our patients. So thank you for coming out, and appreciate your time and your attention.